So hello friends, now this is our next video in general pharmacology, and probably this will be our last video in general pharmacology, in which we are going to basically discuss about the clinical trials. Okay, so first we will discuss the phases of clinical trials. So four phases are mandatory, that is first, second, third and fourth. They are the mandatory phases, and 0 and 5 they are non-mandatory phases. Clear? Now, before going for this, we should look for this. For going for clinical trial, first we will discuss about preclinical trials, that is also known as animal and lab trials. Clear? And what is the purpose of this preclinical trial is just to go for the safety. Okay, if efficacy is second, safety is the most important thing which we look in our preclinical trials. Now, we do various type of toxicological study. Clear? And on the basis of toxicity, we have also divided the grading: acute toxicity, subacute or chronic toxicity. Now, what are the types of toxicity which we study in this? Carcinogenicity we look upon, teartogenicity, then genotoxicity, and many other things which we study in this preclinical trials. Clear? And now, what are the animals we use? So rodents are used, and non-rodents are also used, such as rabbit. Now, one more important point, that we have to follow this GLP guidelines, that is good lab practices, during the clinical trials. And after doing the animal testing, we have to file an IND application, that is investigational new drug application. And this application in USA filed at FDA, and India CDSCO. After getting approval, we can go for the clinical trial, that is for human testing. Getting a point? After getting approval, then we can go for clinical trial, that is human testing. Now coming to the clinical trials, so we have discussed about the phases. 0 and 5th are the non-mandatory phases, but first, second, third, fourth are mandatory phases. Now we have to take consent. There should be proper confidentiality, freedom, autonomy, justice. These are the ethical points which must be present in your clinical trials. Okay, we are moving to the directly to the most important part of clinical trial. So coming to the phases of clinical trial, so mandatory phases are 1, 2, 3 and 4, as we have discussed. One more important point, it is covered under Schedule Y. This is another MCQ question. Okay, Schedule Y tells us how to conduct clinical trials in humans in India. So remember this. Now, during animal testing, we follow GLP guidelines. During human testing, we follow GLP plus GCP. Now, next point, that these phases are quite expensive, and there is no guarantee that whether the drug is going to be successful or not. So for saving money, we have started performing phase 0. This phase 0 is also known as microdosing trial. Microdosing trial, why? Because the dose which is administered here is very little amount, very little amount, and here healthy human volunteers are tested. There is no testing for efficacy. There is no efficacy testing, or there is no safety testing. Just we are knowing the pharmacokinetics of the drug, that is target binding site of the drug. There is no efficacy testing, no safety testing. Getting? Because we are administering drug in very low dose, that is in microgram. So we are just looking the pharmacokinetics and target binding of the drug. If drug does not bind to its target, we will not move forward with expensive phase 1 trial or phase 2 or phase 3. Just we are checking the target binding site of a drug, pharmacokinetics of drug in phase 0. So it is known as microdosing trial. Now after this, we are coming to the mandatory phases. So the first one is phase 1, which is also known as human safety and pharmacological trial. Clear? And number of individual which we take upon is 50 to 100, and the types of individual, they are all are healthy individuals, and the design will be open label. What this is, I will discuss later on, don't worry. Now what are the purposes of the phase 1? That is very important. So first, safety will be included in every phase. Okay, safety will be included in every phase. Now in first phase, you have to look for maximum tolerable dose. Then we look for pharmacokinetics, but no efficacy testing is done in phase 1. Mind it, there will be no efficacy testing in phase 1. This is important MC question. There will be no efficacy testing because we are giving in healthy individual. So we are just looking for safety, we are just looking for maximum tolerable dose and pharmacokinetics of the drug. Now going for the second phase, so it is also known as therapeutic exploratory trial. In this, we usually take 500 to 1000 individual, and all of them are patient, and the design will be RCT with blinding. What it is, I will discuss, don't worry. In this, we look for safety, then The name itself suggesting exploratory means we have to explore. So what we explore? We explore therapeutic dose range and we explore efficacy. So here only exploration is done. Clear? Efficacy exploration and therapeutic dose range exploration. Then the next trial, that is the next phase, that is 3, is known as therapeutic conformity trial. Here that things are confirmed, which are explored in phase 2 are confirmed in phase 3, such as dose confirmation is done here, efficacy confirmation is done here, and here you have to take 5,000 to 10,000 individual, okay, and all of them are patients. Now coming to the fourth phase, that is known as post-marketing surveillance, and here you have to take just patient, and the design is your open label, and here we look for safety, we look for basically hidden or some rare side effects which have not been traced in earlier phases. Then we also look for drug interaction, then long-term compliance or banning of a drug. Getting your point? So we have so these are the 4 phases which we must have to do. Okay, they are mandatory phases: phase 1, 2, 3, 4. So moving to the next. Now, what are the open label? So here patient knows that he is getting actual drug in open label, but in blinding patient does not know whether it is getting actual drug or whether it is giving placebo, whether it is taking placebo or getting actual drug. And when RCT with blinding means randomized control trial. So here 2 drugs are given, one is your test drug and one is your control drug. Getting? Suppose test drug is chloroquine and control is your glucose. And the fake drug or dummy medicine is known as placebo, which we are discussing as placebo. That is a dummy drug or fake drug. Getting your point? Now, coming to the blinding. So single blinding means do not tell the patient whether they are given test or control drug. This is known as single blinding. Double blinding, do not tell the investigator and doctor as well. Along with the patient, doctor is also does not knowing about the drug, particular drug, okay, that whether it is given to patient or not. Clear? So this is the double blind. So these are the 2 things which we have left here. See here, this is the RCT with blinding, RCT with blinding. So move for the next. Now coming to this, so after phase 3 trial for market approval drug, we draft an application which is known as NDA, that is new drug application. In India, CDSO regulate this and USA FDA regulate this, and after approval of this, the drug comes into market, and after that phase 4 is conducted. Getting on? Now moving to the next part. Now comparative study of phase 1, phase 2 and phase 3. So best data for efficacy is your phase 3, best data on safety is also phase 3, most costly is also phase 3. So in all these things you have to just answer phase 3, and maximum failure rates are seen in phase 2. Clear? Maximum failure rates of drug are seen in phase 2, maximum costly, maximum safety, maximum efficacy, all are phase 3. Clear? Now moving to the, so these are the things which you should read on its own. Okay, now moving to the next. Now coming to the phase 5. So phase 5 is also known as pharmacoepidemiology. This is basically extension of phase 4. Here trial is done on large population for long duration of time. And why we are doing? For getting a good evidence, because we have taken a long duration of time in large population, so we will get a good evidence of this. Getting? So these are the phases of drugs, okay, which we have to study on. So these are the clinical trials. Now coming to the last topic, that is also a good short notes in your semester examination, that is adverse drug reaction. So they are the basically unwanted or harmful effects of the drug. The name itself suggesting na, adverse drug reaction means unwanted or harmful effects of the drug, which we study there. Now what are the types? So you have to just use a mnemonics A, B, C, D, E, that so on. So first coming to the A. A means augmented dose or toxicity. A means augmented dose or toxicity. Okay, if a drug is taken in a more amount or in toxic dose, then that side effect, that basically that unwanted effect will be appearing, such as if coming to the insulin. So if insulin is taken more in amount than prescribed amount, then it will cause hypoglycemia. Anyone? It will cause your hypoglycemia. Clear? But this A type is your preventable and predictable. This A type of adverse reaction is preventable as well as predictable. Now coming to the phase, the type B. B means bizarre. Now it is again divided into 2 types. some unwanted effects can occur at even normal dose or even at low dose, getting, and they are non-preventable and non-predictable. They cannot be predicted and they cannot be prevented. Example, allergic reaction to penicillin, and this is basically known as idiosyncratic reaction, which is basically genetically determined. Okay, basically they are genetically determined, so they cannot be prevented or they cannot be predicted as such. Now, the second group is predictable but non-preventable. Example, such as methotrexate. Methotrexate reduces your folic acid synthesis. Okay, we will discuss methotrexate in RA. We have discussed in rheumatoid arthritis video, or we also discussed the drug in cancer. So we usually combine methotrexate with folic acid because methotrexate reduces folic acid synthesis. We generally combine with folic acid. Clear? So methotrexate will cause megaloblastic anemia even at normal dose, and the predictable and non-preventable harmful effects are known as basically side effects. Now coming to the next. So C means chronic use of drug. Example, NSAID. Chronic use of NSAID may lead to peptic ulcer. D means delayed onset of harmful effect. In anti-cancer drug, when you are using anti-cancer drug, then after a long time you will get secondary cancer. We will discuss what are the drugs which are leading to secondary cancers. Now, E4, end of drug. If you are stopping the drug, the side effects will coming up. This is known as withdrawal reaction when you stop alcohol or any other such as opioids or such. F means failure of beneficial effect in cases of drug resistance. If suppose if bacteria is resistant to penicillin, then the drug is basically not going to benefit you. So that is F. So A, B, C, D, E, F. Clear? Now coming to the teratogenic drugs. So drugs that are harmful in pregnancy are known as teratogenic. There are 5 categories. And what are the classification? So see, the first is A, safest, no human fetus risk. B, human fetus is safe, but animals are teratogenic. Okay, animals become teratogenic after getting that, but human fetus are safe. Example, low molecular weight heparin, penicillin, like this drug. And no human fetus risk, folic acid, MgSO4, doxylamine. Now coming to C, human studies are lacking, but animals are teratogenic. So high molecular weight heparin and PPI comes under this. D means human fetus teratogenic, but benefit is more than risk. Human fetus becomes teratogenic when you give this drug, but benefit ratio is more than risk. Drugs are sulfonamides, aminoglycosides, lithium, steroids, anti-epileptics. Now X, these drugs are absolutely contraindicated in pregnancy. Clear? Risks are more than benefit. What are the drug? The first drug is thalidomide, then misoprostol, ACE inhibitors, warfarin, vitamin A, methotrexate, diethylstabastol. So these are the drugs which are absolutely contraindicated in your pregnancy. So remember these drugs: thalidomide, misoprostol, ACE inhibitor, warfarin, vitamin A, methotrexate, and diethylstabastol. Clear? So these are very important drugs. Now coming to this, so this is the overall. Okay, some part is also remaining, so we will discuss in another video. So thank you for watching. Best of luck.